Hello everyone, welcome back. I am Dr. Alexandra Mayer. If you are new to my channel, welcome. We're excited to have you here. And if you've been watching our videos all along, we have a good one today. We are diving into what our viewers' favorite topic seems to be, which is testosterone in women. We've actually talked about this topic in the past, but we've talked about it more from a lifestyle perspective. So more from the perspective of what can we do as women to boost our testosterone production, and why might our testosterone production be plummeting? And that is a really great video. So we're going to link that here if you want to watch it. Today we're going into testosterone replacement therapy in women. Now you might think, oh, that sounds scary, or, well, why would I want to do that, right? Because do women really have that high level of testosterone? And that's really what I see when women walk in my office a lot, is either women don't really think of testosterone as being part of their symptoms, or they do really think that testosterone is part of their symptoms, so they're really, really scared of testosterone replacement. Hormone replacement therapy can get a really bad rap. And so today I want to dispel some of those kind of myths that we're experiencing with that. So let's think about what kind of symptoms would you have if you have low testosterone. So low testosterone really shows up in a variety of ways in women. What we think about is we think about metabolism, so we think about an inability to lose weight, and we think about particularly a decrease in muscle mass, an increase in things like soreness, and a decrease in muscle recovery. And all of those things are really, really important because you do have to have healthy levels of testosterone to be able to make good muscle mass. But we also think about testosterone when it comes to energy, right? And well-being. And when I say well-being, I mean things like mood. So increases in anxiety, increases in depression can show up if women have low testosterone, and just a decrease in well-being where they don't feel like themselves. Other things that can show up with low testosterone would be issues in sleep. And I mentioned this in a previous video, but we make a lot of testosterone when we sleep. And so what we notice is that although sleep can impact our testosterone levels, as our testosterone levels decline, we also get poorer quality of sleep. So it's kind of like we're on this rat race, right? We need to get off. And so testosterone replacement can be an interesting way to do that. So when we think about testosterone replacement, right, we want to really look at age, and then we want to look at life goals. So for example, if a woman is not done having children yet, then testosterone replacement probably is not a good call for her, because you do not want to be on testosterone replacement if you're going to get pregnant. That's contraindicated. So we would look at maybe other things, right? And there are other things that we can do to boost testosterone before we go to testosterone replacement in some women, depending on how low your levels are. When we think about testosterone, right, we think about some of the things that might happen when we go on testosterone replacement. Most of what women think about is acne, hair loss, aggression, like changes in mood and being more aggressive, having an aggressively high libido, which is also one of the #1 reason why women want to go on testosterone, is because of low libido. And then we sometimes do think about, there's a little bit of a myth out there on cardiovascular disease risk and liver risk, as well as breast cancer risk. So let's go into this. So acne, if we're doing testosterone replacement, is going to be the #1 side effect that we have. And some women are just more prone to androgens causing them hirsutism, signs of hirsutism. So what do I mean by that? I mean acne, oily skin, and the pesky little hair growth that we get. Sometimes women will have completely normal levels of testosterone, or the rest of their symptoms are really well managed, but acne and oily skin, they're just kind of more prone. In those patients, right, we do want to make sure that you're well dosed, but we also want to make sure that we're exploring other options for either reducing your conversion to DHT through 5-alpha reductase, so things like pumpkin seed oil, which we've talked about on this channel in the past, or medications like spironolactone can be wonderful at helping with some of those androgenic symptoms. So that is a really common side effect. A less common side effect would be something like clitoromegaly. So clitoromegaly is literally an enlargement of the clitoris. We don't like that. That means that you are over-medicated, and we have to get you on pretty high doses usually to see that, but that is a sign that we definitely want to back down, right? So that can happen. Let's talk about the liver and breast cancer risk, as well as cardiovascular risk. So cardiovascular risk first. The newer studies actually clearly indicate that testosterone replacement therapy in women improves cardiovascular outcomes and improves cardiovascular health in women. And so that has really been starting to be dispelled with research, which is great. The same thing with liver disease. So liver, we know that oral testosterone definitely can cause some liver damage, but we don't give oral testosterone, and that's definitely not a good dosing strategy in women. And we do change our dosing strategies in women, which we'll talk about in a second. But so that's all about the way that we dose the testosterone, and if you're dosing testosterone appropriately, liver disease risk should be very minimal. Breast cancer risk, right? So this is a big one. And oftentimes people think with breast cancer risk that they should be avoiding hormones altogether. Well, there's some really interesting pellet studies, so done with pellet therapy, studies that indicate that women with higher levels of testosterone through testosterone replacement actually, in a lot of cases, have lower breast cancer risk than never users of hormones, which means that they've studied women who are on pellets, testosterone, and never have used hormones, and the women on pellets actually do better. And this is made even better with pellets that have inostrozole in them, which is an estrogen blocker. Because really what we're worried about if we're giving testosterone to somebody who has a history of breast cancer or breast cancer risk would be that it's going to convert to estrogen and then increase our breast cancer risk. So there are ways that we can avoid that by giving things like an estrogen inhibitor. Perfect. So that actually could limit risk long term. I mentioned a little bit about dosing strategy. So with dosing strategy, right, we want to look at, usually in women, I start with things like a cream or maybe a troche, which is a sublingual. Technically, both of those go through the mucosa, which means that they are not going through the GI tract, right? Now, sometimes with troches, a little bit can go through the GI tract. So if you're using a troche, you really want to let it dissolve as much as possible. You don't want that to go through your GI, but they allow for different absorption. I like to start with things like that because it allows for better titration in women. So we can titrate your dose up and down. We can make changes as opposed to something like pellets, right? If we put pellets in, they're in there for the most part. We can take them out, but we really don't usually do that. And so at that point, what we want to do is we want to get you stabilized, make sure that testosterone is actually indicated in your case, both labs and symptom management wise, and that you're not having any negative adverse effects before we go to something long term. A lot of doctors do injectables in women. I don't do injectables in women. It's not really my dosing strategy, but some do. And then a lot of clinics will do pellet therapy. So with pellet therapy, the biggest thing that I think women need to think about with pellet therapy is what is your dose when your pellet is in. A lot of clinics, unfortunately, will put pellets in and they kind of just close their eyes for 3 or 4 months and then they draw labs right before they reinsert pellets, which means that we can really get good symptom management for women and women feel like superheroes on testosterone. But oftentimes I have those women come to my office where we draw their testosterone and their testosterone is sky high, like way higher than it should be. And then I have also had a lot of women come in with the symptoms like clitoromegaly, because their dose just is crazy. So with pellet therapy, you really want to make sure that you're drawing those at least when you're changing any sort of pellet dose to make sure that you're on the right dose and that we know what your labs are doing after we put it in, right? We don't like to guess. We don't like to close our eyes. We don't like to just be like, oops, we'll see you in 4 months. We want to have a better idea. And so that really is about the way that the clinic does pellets. I think there's really safe and effective and awesome ways to do them. And then I think there's some ways to do it that wouldn't be my recommended choice. The last thing that I want to talk about with testosterone therapy is hair loss. So I've been talking a lot about hair loss lately, and I've been talking a lot about hair loss because post-viral hair loss and post-stress hair loss is a thing. But we also think about hair loss when we think about testosterone. Oftentimes, we kind of get this from the idea of hair loss in men, right? And that conversion of testosterone to dihydrotestosterone, which we know is stronger, more active at that hair follicle and causing the hair to fall out. That can happen, but what's interesting is that the most up-to-date research on testosterone actually indicates that testosterone replacement in women might help hair growth. Yep, I said that, help hair growth. What we find is that women are able to grow healthier hair and that their hair cycle tends to normalize with testosterone replacement therapy if it's done in good dosing. So in women who are having hair loss from their testosterone replacement, usually if I see that, it's because they're dosed just way, 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 way too high. So I hope that that clears up some of the myths that women have surrounding testosterone replacement, or some of the things that sometimes women think, okay, am I going to get these side effects because I don't want to lose my hair? I'm already losing hair, right? And showing that having healthy levels of testosterone and somebody who's actually, monitoring your levels appropriately can make a big difference in well-being and how you feel in your life, and can be a really, really great strategy for allowing you to continue to feel great long term. We'll see you next week for next week's video.